Welcome back to another episode of 5 Minutes With, where we spend 5 minutes with people who are making an impact. I'm Morgan Allen, joined by my wonderful host, Dr. Suny Caminero.
Thank you.
Yes,
I'm
with
excited to be here today.
Yes, thank you for joining. So we have a special guest. We have Alex Hill with OncoPelvic PT. Alex, thank you for being here.
Yes, thank you so much.
Yes, tell us a little bit about OncoPelvic.
As you said, my name is Alex Hill. I'm a dual board certified physical therapist here in Jacksonville. I specialize in women's and pelvic health and oncology or cancer rehab. And OncoPelvic PT is that blend of specialties. So I offer concierge pelvic health and oncology physical therapy services here in Jacksonville on the south side, but also through telehealth, and in-home mobile appointments are available as well. This practice just started last fall, although I have been practicing for 12 years. And so it's a really great way to bring concierge specialized services to everybody in Jacksonville.
Dr. Hill, I love that you have set this up. Tell me who is your population? I hear oncology patients, pelvic floor rehabilitation, but tell us more of, are these mostly breast cancer survivor patients? Are these patients radiation therapy? Tell us a little bit more about that population that you serve the most.
Yes, absolutely. So on the oncology side, I work a lot with breast cancer survivors. So that can include if they have issues with scar tissue after a surgery, radiation and radiation fibrosis, if they have swelling or lymphedema that can present in the breast or the arm as well. But a lot of people don't realize that many breast cancer survivors and other cancer survivors also deal with sexual concerns or intimacy concerns as well because of their treatment. And so we can address that as well. I also work with head and neck cancer survivors and pelvic cancer survivors. So whether that be prostate cancer, gynecological cancer, or colorectal cancer as well. And then specifically on the pelvic health side, really any adult, any gender who has pelvic health concerns. So that could be bladder issues like urgency or leakage, pelvic organ prolapse, where the organs start to drop or descend down into the pelvic bowl, constipation or other bowel concerns, or even pelvic pain. And that could be abdominal pain, pubic symphysis pain during pregnancy, or even tailbone pain or other concerns, kind of what we say below the belt in pelvic health.
Dr. Hill, there's a few things that I see a lot of patients have struggles with and centered around these questions of sexual health. So I'm really thankful that you brought that up. Tell us more about sexual health and being a breast cancer survivor. Often women feel like I survived cancer, and so people tell me, well, you survived cancer, you should be happy you survived cancer, right, even though there's so many other things that are happening to their body that they're not living their best life. Tell us more about that. How do you tackle that part with the pelvic floor and sexual health and urinary incontinence?
That is something that comes up very, very frequently in my practice. And it's exactly like you said, many people feel either survivor's guilt or they feel like, okay, like I beat cancer, I should just be happy that I beat cancer. But I challenge them and I say, you beat cancer, you should be enjoying every part of your life and everything that includes, including intimacy. Our sexuality and our intimacy with ourselves, with our partner, is really key for quality of life, for our identity, and for good, healthy relationships. And so with those visits, what we do is we talk about kind of what their goals are. And that may mean looking at what might be kind of their new normal, or ways that we can supplement or address some of their concerns. So with breast cancer survivors specifically, hormone therapy is a very common treatment. But what that does is it essentially causes a medically induced menopause. What we know with menopause, and especially medically induced menopause, is it can cause issues like vaginal dryness, pain with intimacy, decreased libido. And so we can address all of those on the pelvic health side, but also specifically on the PT and rehab side, we can also address some of the other components involved with intimacy, like if you have decreased range of motion, if you have neuropathy or altered sensation in your hands, if you have fatigue daily and then you don't have enough energy for intimacy, We can also talk about different ways for energy conservation, or even positions that might not take as much energy to still be active with intimacy with your partner.
Beautiful. It is so important to have intimacy in your relationships and also to feel comfortable doing so. So I love what you said there. Is there anything that any person watching this can do to get out ahead of pelvic issues?
I think the first and foremost thing is just being aware of your body and anything that you are bothered with, and see if that might be something that you can talk about with your provider or, with a physical therapist. And is that something that you can address? So if you've been suffering from anything pelvic health related, just recognizing that, there is help available can really be an empowering first step. And then that next step is then asking for help. What's really nice in the state of Florida is that people have direct access for physical therapists. So what that means is you don't need a referral from a medical provider to at least start with physical therapy and get going on treatment to help you to get feeling better. So sometimes getting in with a specialist or getting a referral can be a little bit of a hindrance. So again, we want to try to find ways to empower people. So again, recognizing that if you have symptoms, that's not something you have to live with. Empower yourself, advocate for yourself, and get the help that you deserve.
Beautiful. Thank you so much, Alex, for joining us. Thank you, Dr. Suny.
Thank you so much for having me, and thank you, Alex, for joining us. Your information is invaluable.
Absolutely.
Thank you so much for having me.
And viewers, we thank you for tuning in to another episode. If you want more information, you can look below this interview right here. We have her info and many other profiles here on dailynewsnetwork.com. And we'll see you in the next episode of 5 Minutes With.
Hi, I am Dr. Suny Caminero, and I am a board-certified gynecologist in Florida and founder of Cosmetic Gynecology Florida. I opened this practice because I wanted to give women the care they deserve and be able to provide a comprehensive treatment for women in one location. Here in Cosmetic Gynecology, we really focus on the topics that women are embarrassed to talk about. It's the things that affect women on how they feel in their body, how they function, how they have their relationship, their self-esteem, and the things that are blocking them from being the best self that they can be. Anything that has to do with their vagina, with their labia, with their clitoris, all of those things are really hush-hush, and women are not encouraged to talk about, and also they're embarrassed to talk about it. Urinary incontinence, hormonal imbalance, just not feeling comfortable in your own body. These are the issues that we want to solve. Over the years, I have obtained specialized training to be able to provide care for women in the different aspects that affect their individual parts as well as the whole part. We have curated this entire experience to give you the solutions and the results that you deserve. From the moment you walk in through this door, it is a safe environment. It is a calm setting. What we want is for you to feel comfortable to discuss anything with us. When you're completely comfortable talking about what's going on, we can give you real answers. Everything that we do in this office is thoughtful, is private, and is centered around you. There is no pressure, there is no judgment, there is just real solutions. Because your quality of life is not an option. Expect more from your body, and we are here to help you live your best life.